How is this quasi-governmental entity that would administer the health insurance purchasing pool, how's it going to be funded?
The funding will come from, it will not require any new dollars to be generated, but funded most likely from the participants in the program, because they're going to have their health insurance premium costs reduced substantially, and the administration costs will be relatively small and then would be spread over the...
How much would you estimate total?
I can't estimate it because I don't have access to them. You would have to have, it would depend on how many bought in initially, so there would be so many criteria that would determine that. But to run simulations or projections, you really have to have access to some pretty good...
What kind of, what kind of contribution would the typical small business be expected to contribute in order to participate in the pool?
It would be minor. It would be less than what they're now paying to administer their own health insurance programs, because it would be spread over so many. So in addition to the premium costs going down, you know, for any small business, you have two costs. You have the cost of the premium, but then you also have the administrative cost in your office of administering the benefits programs. And it would be considerably less than they would be paying now, because they would be spreading that administrative cost. That administrative cost would be spread across so many businesses.
Well, would this be separate from the current Healthy Indiana plan, or an adjunct to it?
I see it as a separate.
Okay. Would any portion of it be funded through what we now have with the cigarette tax?
Just the 3 cents that is now some of that is now used to help offset the cost of health insurance for small businesses.
That's already being collected as part of it.
And do you know, there have been some estimates on this. Yeah, it's not a new tax or anything. But you know, there have been some estimates that you can save as much as, Emily, is it 24% by going from an individual to a group plan? That's not from a group to a larger group plan, but as much as 24% savings. And that's significant.
Would you anticipate that the health insurance pool, would it cover all sorts of health insurance claims or catastrophic only?
No, it would be comprehensive coverage,
okay.
But individuals will choose different options. Some people like higher deductibles, for example. So you may have different options, and some may choose a higher deductible plan. Mm-hmm. For example.
So the state might be kind of the facilitator, but there would be sort of a quasi-government entity that would actually be the administrator of the plan.
You know, I put money into a pension fund, federal pension fund, and there's this quasi-governmental agency that administers that, and of course I pay for that. But, so it's the same kind of thing.
Right. Would it require action by the General Assembly of your governor in order to enact this, or
yes.
Could it be done by executive?
I think this would require legislative action, but I also think that we will get the best policy if we debate and discuss it.
Right. Yeah. Is there anything currently taking place in any of the other 49 states
yes.
that's comparable?
New Mexico, Montana. Emily? New Mexico, Montana.
States that have full options available.
Mm-hmm.
Kansas, California, New York.
Ohio. Ohio's is old. Ohio's has been around for a long time.
1973. Wisconsin. There are 9 of them. I don't know how many are coming there.
Is it in the race?
Yeah, I think it is.
Yeah, the Cleveland example is right.